Well, hello and welcome back to Med Monday. I'm Cynthia Primavera, lead instructor for Nursing School Simplified, and I'm so glad you're here today. So let's get started. So, our medication today is hydromorphone, otherwise known as Dilaudid. It is an opiate analgesic. It can be given PO, IV push, through an IV drip, or through intramuscular or subcutaneously. It inhibits pain pathways in the CNS and it alters pain perception. It's metabolized in the liver, so that is important to know, and it's excreted by the kidneys. Narcan is the reversal for this medication. The indication for this, of course, is moderate to severe pain. Contraindications include hypersensitivity, COPD, cor pulmonale, emphysema, ileus, increased ICP intracranial pressure, and status asthmaticus, and obstetric delivery. Side effects include dizziness, drowsiness, sedation, and confusion, especially in older patients, bradycardia, hypotension, and tachycardia. The tachycardia would be a compensatory response to bradycardia and hypotension. Nausea, vomiting, especially if it's given too quickly, if you push the dose too fast. Adverse reactions include severe respiratory depression, seizures, and anaphylaxis. So, our nursing considerations include knowing that this is a black box warning for respiratory depression. So, anytime we're administering this, we want to be sure that we're monitoring our patient's respiratory rate, pattern, and effort. We want to monitor for urinary retention. We want to monitor for CNS changes, especially in our geriatric population. We want to monitor for bowel function. We want to make sure that we're assisting our patients with ambulation and that they know to call for assistance. And we want to monitor our vital signs. And again, we want to use with caution with our geriatric patient population. And we want to evaluate therapeutic response. Is this working for our patients? Do they need a higher dose? Do they need a lower dose? Do we need to add some other medications to help with their pain management? So teaching our patients, we need to be sure that they're aware of the signs and symptoms of allergic reactions, that they take this medication as prescribed. Now, some patients will be taking this in the outpatient setting for chronic pain or for other issues. So we want to make sure that they know to take this medication as prescribed. To avoid driving, of course, and avoid alcohol and any other depressants. So, our challenge question this week is you are caring for a postoperative 78-year-old male. The PA orders hydromorphone point, I'm sorry, 0.5 milligrams IV push Q5 minutes for maximum dose with a maximum dose of 2 milligrams. Sorry about that. The pharmacy has stocked the Pyxis with hydromorphone 2 milligrams per ml carpet jets. How many mLs will you give for each dose? And this is a very common um, dosing for our postoperative patients. We usually give fentanyl Q5 minutes. We can give Dilaudid Q5 minutes. Um, and depending on the patient's age, liver function, renal function, we can adjust those doses. So sometimes I do see the Dilaudid at 0.25 milligrams. So just make sure that you're aware of these, especially with this Q5 minutes. This would be something post-operatively. This would not be something that you would continue on the floors because we do need to make sure that our patients are still breathing. So go ahead and leave your answer in the comments and you will be entered to win a $25 Amazon gift card. And I hope you all have a great week and I will talk to you next time. Thanks. Bye bye.